Hello, and welcome to Dr. Nguyen's YouTube channel. Today, we dive deep into a topic that's often misunderstood, yet highly important: sexually transmitted diseases. Knowledge is power, and it's essential to understand STDs, their symptoms, and treatments. Our aim is to strip away the stigma and fear, replacing them with clear, straightforward information. This isn't just about disease, it's about health, well-being, and taking control. So stay with us as we unravel the facts about common STDs and their symptoms. Sexually transmitted diseases, or STDs, are infections that are passed from one person to another through sexual contact. They are a silent epidemic, often lurking without symptoms, yet with the potential to cause serious health problems. Let's break it down. STDs are caused by a variety of organisms. They can be bacterial, like chlamydia, gonorrhea, and syphilis; viral, like herpes, human papillomavirus, or HPV, and HIV; or parasitic, like trichomoniasis. These diseases are transmitted through intimate physical contact, primarily sexual activity, but also through sharing needles for drug use, or from mother to child during childbirth or breastfeeding. Why are STDs such a big deal? Well, while some STDs can be cured with antibiotics, others, particularly viral STDs, have no cure. They can only be managed with treatment to alleviate symptoms or reduce transmission risk. Untreated STDs can lead to severe health complications, including infertility, certain types of cancer, and increased susceptibility to HIV. In pregnant women, STDs can lead to complications like premature birth and congenital infections in the newborn. That's why prevention and early detection are key. Prevention strategies include practicing safe sex, getting vaccinated against preventable STDs such as HPV and hepatitis B, and regular testing for sexually active individuals. Early detection is crucial because many STDs often have no symptoms in the early stages, yet they can still be transmitted to others and cause health problems. It's important to remember that anyone who is sexually active can get an STD. It's not about morality or character, it's about biology. And while STDs can be uncomfortable to talk about, open and honest communication with your sexual partners and healthcare providers is essential for your health and the health of others. With that in mind, let's delve into some of the most common STDs, their symptoms and treatments. When it comes to STDs, there are several common culprits we need to be aware of. Let's delve into some of these and their telltale signs. First up is chlamydia, one of the most common sexually transmitted diseases. It often presents no symptoms, which is why it's sometimes referred to as a silent infection. But when symptoms do appear, they can include pain during urination, lower abdominal pain, vaginal discharge in women, and discharge from the penis in men. Next, we have gonorrhea, another highly prevalent STD. Much like chlamydia, gonorrhea can be tricky to identify as it may not cause noticeable symptoms. However, when they do occur, they can range from painful urination and abnormal discharge from the genitals to, in rare cases, pain and swelling in one or both testicles. Then there's syphilis. This one can be particularly deceptive as it progresses through stages with different symptoms. In the first stage, one or more sores can appear, often painless and easily overlooked. The second stage may present a rash, fever, and swollen lymph nodes. If not treated, the disease can progress to more serious stages affecting the heart, brain, and other organs. Herpes, another common STD, is characterized by outbreaks of painful sores or blisters on or around the genitals or mouth. It's worth noting that these outbreaks can occur intermittently, with periods of dormancy in between. Lastly, let's talk about HIV. This virus undermines the immune system, making the body more susceptible to other infections and diseases. Early symptoms may include fever, fatigue, and swollen lymph nodes, but HIV can also exist in the body for years without showing any signs. Remember, these symptoms can vary greatly from person to person, and some people may not exhibit any symptoms at all. It's also important to know that many STDs can be asymptomatic, meaning they present no symptoms, which is why regular testing is crucial. Moreover, be aware that some symptoms can overlap with those of other conditions, so it's important not to jump to conclusions or self-diagnose. If you're experiencing any symptoms or have had unprotected sex, it's always best to seek medical advice. In the end, knowledge is power. The more we know about these diseases, the better we can protect ourselves and our partners. Remember, these symptoms are just that, symptoms. They are not the disease itself. The disease is the bacteria, virus, or parasite that causes the infection. And just like any other disease, STDs can be managed and often cured if caught early. Knowing these symptoms is the first step to early detection and treatment. The good news is, many STDs are treatable, and some are even curable. Let's delve into how these conditions can be managed and, in some cases, completely eradicated. Starting with bacterial STDs like chlamydia, gonorrhea, and syphilis, these are usually curable with antibiotics. It's important to follow your healthcare provider's instructions carefully and take all of the prescribed medication, even if the symptoms disappear before you've finished the course. This ensures that the infection is completely cleared and helps to prevent antibiotic resistance. Next, let's talk about viral STDs. Conditions like herpes, HIV, and HPV cannot be cured, but they can be managed effectively with antiviral medications. These medicines can help suppress the virus, control symptoms, and reduce the risk of transmission to others. It's important to note that even with treatment, these viruses can still be transmitted, so practicing safe sex is essential. Now, for parasitic STDs like trichomoniasis, these can usually be treated and cured with prescription drugs. Just like with bacterial STDs, it's crucial not to stop taking the medication early, even if symptoms vanquish quickly. One thing to remember with all STD treatments is that they address the infection, not the exposure. This means if you've been treated for an STD, it's possible to get the same infection again if you have unprotected sex with someone who has that STD. It's also worth noting that some STDs can have serious long-term health impacts if not treated promptly. This includes conditions such as pelvic inflammatory disease in women, which can lead to infertility, and epididymitis in men, which can also cause fertility issues. HIV, if untreated, can progress to AIDS, a life-threatening condition. That's why it's imperative to see a healthcare provider if you suspect you have an STD. They can diagnose your condition and recommend the most effective treatment. Remember, early treatment is key in managing STDs and preventing complications. While it's crucial to know the symptoms and treatments for STDs, prevention remains the best strategy. The old adage, "An ounce of prevention is worth a pound of cure," rings especially true when it comes to sexually transmitted diseases. So, how can we ensure our safety? First, practicing safe sex is paramount. This means using condoms correctly every time you engage in sexual activity. It's the most effective way to reduce your risk. Second, regular health checkups are a must. Timely screenings can catch infections early before they become more serious. Don't hesitate to discuss your sexual health with your doctor. They are there to help, not to judge. Lastly, vaccines are available for some STDs like human papillomavirus and hepatitis B. These vaccines can protect you from the most common types of these diseases. In the fight against STDs, knowledge is your best defense. So stay informed, stay safe, and remember, prevention is always better than cure. Before we wrap up, let's quickly summarize what we've covered today. We've delved into common sexually transmitted diseases, their symptoms, and the treatments available. From chlamydia to gonorrhea, herpes to HIV, we've covered the spectrum. We've reiterated how crucial it is to recognize these symptoms early and get treatment promptly. Above all, we've underscored the importance of prevention through safe sexual practices. Thank you for joining us today. Remember, your health matters. Stay safe and stay informed.